concern that the
Alors, il y a
increase
des
in more
préoccupations
transmissible
que
variants is
l'augmentation
threatening
des
our
cas de
progress
variants plus
before
transmissibles ne
vaccines
freine
can
nos
bring
progrès
full
avant que nous
benefits.
puissions profiter
To
pleinement de
date,
l'avantage de la
over
vaccination. Jusqu'à présent, plus
922,000
de
cases of
922 000 cas de
COVID-19,
COVID-19,
including over
dont plus de
22,500 deaths, have
22
been
500 décès
reported across
ont été
Canada.
signalés au Canada.
Over the past week,
La semaine
there has been an
dernière,
8%
nous avons
increase in daily
constaté une
cases,
augmentation du nombre de
with an
cas
average
quotidiens de
of
8%,
almost
soit en
3,300
moyenne
new
près de
cases
3
daily.
300 nouveaux cas par jour.
Declines in lagging
La baisse
indicators of
du
COVID-19
nombre des
severity are
indices
also
de
showing
gravité
signs of
tardive de la
leveling off
COVID-19
or
montre
increasing
également des signes de
slightly.
stabilisation ou de légère
On average,
augmentation.
over the past week,
En moyenne, la
31
semaine
deaths
dernière,
were
31
reported
décès ont
daily,
été
and
signalés
close to
par jour et près
2,060
de
people with
2060
COVID-19 being
personnes
treated in
atteintes de
our hospitals
COVID-19 ont
each
été
day,
traitées dans nos hôpitaux
including
chaque
over
jour, dont plus de
560 in critical care.
560 qui étaient aux soins
To
intensifs.
date, about
Jusqu'à présent,
4,500 variants of
environ
concern
4
cases
500
have
cas
been
de variants
reported across
préoccupants ont
Canada,
été signalés au
with
Canada.
the B117
Le
variant
variant
accounting for over
B117 représente
90%
à
of
ce jour plus de
these to date.
90% de ces cas.
In some parts of
Dans
Canada,
certaines
variants of
régions du
concern now
pays, les
represent a
variants
high proportion
préoccupants
of
représentent
cases,
désormais
and the
une
number of
portion
outbreaks
élevée des cas,
involving these
et le nombre
variants
d'éclosions
are
de cas
increasing.
portant ces variants augmente.
Things will get
La
easier if we
situation
keep
sera plus
COVID
facile si
activity
nous
at
maintenons
manageable
la
levels as
transmission de
vaccines
COVID-19 à
continue
des
to
niveaux
roll out over the
gérables
coming
à mesure
weeks.
que les campagnes de
At
vaccination
this point,
continueront dans
Team
les prochaines
Variant has the
semaines.
ability to
À ce
take off
stade,
fast.
l'équipe des
This is a
variants a la
crucial
capacité
moment.
de prendre le départ
If we
rapidement.
don't
C'est un
slow
moment
down the spread of the
crucial. Si
variants,
nous ne ralentissons
Team
pas la
Vaccine is
propagation
at
des
risk of
variants,
falling
l'équipe des
behind.
vaccins, des
But if we
vaccinés
can
risque
hold
de
on
tirer de
and give
l'arrière.
it that
Mais
last
si nous
push
tenons
by
bon et
keeping
fournissons
up
un
with
dernier
personal
effort en
protective
respectant
measures
les
and
mesures de
limiting
protection
our
individuelles et
contacts
en
to the
limitant
extent
nos
possible,
contacts dans la
we
mesure du
will clear
possible,
the path
nous
for Team
dégagerons le
Vaccine
terrain
to
pour
cross
que
the
l'équipe
finish
des
line.
vaccinés remporte la course.
There are encouraging developments
Chaque jour
with
qui
each new
passe
day.
apporte
The rates of
des nouvelles
COVID are
encourageantes.
dropping in
Le
elders
nombre de
80
cas de
years of
COVID-19 est
age
en
or older,
baisse chez les
with a
personnes âgées de
downward trend in
80 ans et
long-term care
plus,
home
et le nombre
outbreaks.
d'éclosions dans les centres de soins de
Each
longue
week,
durée tend
a
à
new
chuter.
high is being
Chaque
set for the
semaine, un
number of
nouveau record est
COVID-19
établi en ce
vaccine
qui
doses
concerne le
administered,
nombre de doses de
with
vaccins
over
administrées. Plus de
670,000 doses
670
of
000 doses
COVID-19
ont été
vaccines
administrées
administered
rien
this past
que
week
cette dernière
alone,
semaine.
and more than
Et plus de
3.5 million
3,5
doses
millions de doses
administered
ont
to
été
date across
administrées au
Canada.
Canada à ce jour.
There have been recent reports in Europe
Récemment,
of
on a
blood clots
signalé des
following
cas de caillots
vaccination with the
sanguins en
Astrazeneca
Europe à la suite de
vaccine.
l'administration du
Health
vaccin
Canada has
d'AstraZeneca.
been
Santé
working
Canada a
closely
travaillé en
with
étroite
international
collaboration
regulators
avec les
to
organismes de
gather and assess
réglementation
the available
internationaux pour
information,
recueillir
and has
et pour
determined that the
évaluer les données
AstraZeneca
disponibles et
vaccine
a déterminé
has
que le
not
vaccin
been
d'AstraZeneca
associated with an
n'a pas
increase
été
in the
associé à une
overall
augmentation
risk
du risque
of blood
global
clots.
de caillots sanguins.
Rare adverse events are
Il est
expected to
attendu
be
à ce que
detected
les effets
when
secondaires
vaccines are
rares
given
soient
to
détectés
millions of
lorsque des
people.
vaccins sont administrés
They
à des
must
millions de
always
personnes.
be taken
Ils doivent
seriously
toujours être
and
pris au sérieux
investigated
et faire
thoroughly.
l'objet d'un examen approfondi.
It is possible
Il
that
est
the
possible
vaccine may
que le
be
vaccin soit
associated with very
associé
rare
à de
but
très
serious
rares cas
cases of blood clots
graves de caillots
associated with
sanguins
low
liés à
level
des
of
taux de
platelets,
plaquettes
which
faibles,
merit further
lesquels
analysis.
méritent une analyse plus
Health
approfondie.
Canada will
Santé
continue
Canada
to work with
continuera de
international
travailler avec les
regulators and
organismes de
review data
réglementation
and
internationaux
evidence as
et
it becomes
d'examiner les
available,
données et les preuves au fur et à mesure
including as
qu'elles
it pertains
émergeront,
to these
notamment en ce
rare
qui
events.
concerne ces effets rares.
Overall, the
Dans
benefits of the
l'ensemble, les
AstraZeneca
avantages du
COVID-19
vaccin
vaccine in
d'AstraZeneca pour
protecting
protéger les
Canadians
Canadiens
from
contre la
COVID-19
COVID-19
continue to
continuent de
outweigh the
l'emporter sur
risks.
les risques.
Ensuring that all vaccines authorized for
Tous
use in
les
Canada are
vaccins
safe
autorisés au
is a
Canada
priority for health authorities
doivent
across
être
Canada,
sûrs et
who
l'ensemble des
continue
autorités
to monitor,
sanitaires continuent
investigate, and
de
report through
surveiller, d'enquêter,
countrywide
de faire rapport
vaccine
aux moyens de
safety
systèmes de
surveillance
surveillance
systems.
de
To
l'innocuité des
date, there
vaccins à
have
l'échelle
been no
nationale. À
safety
ce jour,
signals of
aucun
concern
signe de
detected
nocivité
following
préoccupant
vaccinations
n'a
in
été
Canada.
détecté à la suite de vaccination au
As
Canada.
these vaccines work to
Ces
protect more
vaccins
and more
permettent de
Canadians,
protéger de plus
let's
en
play
plus de
our
Canadiens.
part
Mais
by
jouons
staying
notre
strong
rôle en
and
restant
helping each
forts
other,
et en
following public
s'entraidant.
health advice, keep up
Suivons
with
les
individual
consignes de santé
practices,
publique,
and
continuons d'appliquer
prepare
les
to take
pratiques
your
individuelles et
place in the
soyons
queue
prêts
when the
à
time
recevoir le
comes
vaccin
for you to
le
be
temps venu.
vaccinated. Thank you.
Merci.
Bonjour à toutes et à tous. Il y a des
Good morning, everyone.
préoccupations que l'augmentation de
There
cas
is
de variants
concern that
plus
the increase in
transmissibles
more
ne freine
transmissible
nos
variants
progrès
is threatening
avant
our
que nous
progress
puissions
before
profiter
vaccines can
pleinement
bring
de
full
l'avantage de la
benefits.
vaccination. Jusqu'à présent, plus
To date,
de 922 000 cas de
over
COVID-19 dont plus de 22 500 décès ont été signalés au Canada. La dernière semaine, nous avons constaté une augmentation du nombre de cas quotidiens de 8 soit près de 3 300 nouveaux cas par jour en moyenne. La baisse du nombre des indices de gravité tardif de la COVID-19 montre également des signes de stabilisation ou de légères augmentations. La dernière semaine, 31 décès ont été signalés en moyenne par jour et près de 2060 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont plus de 560 étaient aux soins intensifs. Jusqu'à présent, environ 4 500 cas de variants préoccupants ont été signalés au Canada. Le variant B117 représentant à ce jour plus de 90 de ces cas. Dans certaines régions du pays, les variants préoccupants représentent désormais une proportion élevée des cas et le nombre d'éclosions de cas portant ces variants augmente. La situation sera plus facile si nous maintenons la transmission de la COVID-19 à des niveaux gérables à mesure que les campagnes de vaccination continueront de se dérouler dans les prochaines semaines. À ce stade, l'équipe des variants a la capacité de prendre les départs rapidement. C'est un moment crucial. Si nous ne ralentissons pas la propagation des variants, l'équipe des vaccinés risque de tirer de l'arrière. Mais si nous tenons bon et fournissons un dernier effort en respectant les mesures de protection individuelles et en limitant nos contacts dans les mesures de possible, nous dégagerons le terrain pour que l'équipe des vaccinés remporte la course. Chaque jour qui passe apporte des nouvelles encourageantes. Le nombre de cas de COVID-19 est en baisse chez les personnes âgées de 80 ans et plus, et le nombre d'éclosions dans les centres de soins de longue durée tend à chuter. Chaque semaine, un nouveau record est établi en ce qui a trait au nombre de doses de vaccins administrées. Plus de 670 000 doses ont été administrées rien que la dernière semaine et plus de 3,5 millions de doses ont été administrées au Canada à ce jour. Des cas de caillots sanguins ont été signalés récemment en Europe à la suite de l'administration du vaccin d'Astrazeneca. Santé Canada a travaillé en étroite collaboration avec les organismes de réglementation internationaux pour recueillir et évaluer les données disponibles et a déterminé que le vaccin d'AstraZeneca n'a pas été associé à une augmentation du risque global des caillots sanguins. Cependant, le vaccin pourrait être associé. Il est attendu que des efforts secondaires rares soient détectés lorsque des vaccins sont administrés à des millions de personnes. Ils doivent toujours être pris au sérieux et faire l'objet d'un examen approfondi. Il est possible que le vaccin soit associé à des très rares cas graves de caillots sanguins liés à des taux de plaquettes faibles, lesquels méritent une analyse plus approfondie. Santé Canada continuera de travailler avec les organismes de réglementation internationaux et d'examiner les données et les preuves au fur et à mesure qu'ils émergent, notamment en ce qui concerne ces effets rares. Dans l'ensemble, les avantages du vaccin d'AstraZeneca pour protéger les Canadiens contre la COVID-19 continuent de l'emporter sur les risques. L'ensemble des autorités sanitaires du pays ont comme priorité absolue de veiller à ce que tous les vaccins autorisés au Canada soient sûrs et elles continuent de surveiller, d'enquêter et de faire rapport aux moyens des systèmes de surveillance de l'innocuité des vaccins à l'échelle nationale. À ce jour, aucun signe de nocivité préoccupant n'a été détecté à la suite des vaccinations au Canada. Il est vrai que ces vaccins permettent de protéger de plus en plus de Canadiens, mais jouons notre rôle en restant forts et en nous entraidant. Suivant les consignes de santé publique, continuons d'appliquer des pratiques individuelles et soyons prêts à recevoir le vaccin le temps venu.
Merci beaucoup. I will now take questions.
Prenons maintenant les questions.
One question and one follow-up. Et vous pouvez poser vos questions, votre question et une question de suivi dans la langue officielle de votre choix. Operator, over to you.
Opératrice
Thank
ou opérateur,
you.
à vous.
Merci.
Merci.
Please press star 1 at this time.
Appuyez
If you
sur
have a
étoile
question,
1 si
vous
vous avez
pouvez
une
appuyer
question.
sur étoile 1 maintenant pour poser une question. Our first question is from Mike
Première
Lacouture
question, Mike
from Global
Lacouture
News.
de Global News.
Please go ahead. À vous la
Allez-y,
parole.
à vous la parole.
Thanks
Question.
for taking our question.
Merci
This
de
is for
prendre
Dr.
notre
Tam
question.
and or
C'est pour
Dr. New.
Dr. Tam ou Dr. New?
Your first comment off the
Votre
top
premier commentaire
saying
au
that our
départ,
progress
quand
is
vous
being
disiez que les
threatened,
choses
and when we see that the variants
semblaient assez
are
menaçantes,
spreading
quand
very
on voit
quickly,
que les
especially
variants se
in
propagent
younger
rapidement,
adults.
surtout chez les jeunes
I want to
adultes,
sort of ask you this in two parts. Are you
j'aimerais
concerned that
vous poser une
Canadians
question en deux
somehow
parties.
don't
Est-ce que vous êtes
understand the heightened
inquiet que
danger
les
at this
Canadiens ne
time?
comprennent pas les
And
dangers
in your
élevés
opinion, is it time for
qui
stricter
planent et
guidelines
pensez-vous qu'il faudrait imposer des lignes directrices
for
plus
movement for
strictes
people
pour le
in
déplacement
different
des personnes
jurisdictions
dans les différentes
because this
régions?
is such a critical
Justement parce
time
que c'est une époque
and that we could be
cruciale
teetering
et
here?
qu'on pourrait peut-être basculer.
Yes,
Réponse
I'll
de la
take
Dr.
the
Tam.
first response to
Alors, je vais
this
répondre à la
question.
première partie de votre question.
Yes, there is
Oui,
an indication that after
il semble
coming
qu'après
down that
cette
second wave, that
chute ou après
downslope,
cette
we initially sort of plateaued at
après la
about
deuxième
2/3 of
vague,
the
il y a eu
way
un petit
down, and then we're
plateau vers
now
les deux
beginning to see an
tiers
uptick in
de la deuxième
cases.
vague et les choses semblent
And in
reprendre un petit
particular,
peu le dessus et avec une
it's
recrudescence du nombre de
areas
cas.
where variants of
Il y a des
concern.
régions où les
These are
variants
variants that can
préoccupants
be transmitted more
sont
easily, so they
transmis plus
spread
facilement, donc ils se propagent
faster.
plus
And
rapidement.
so that is
Et
the
ça,
current
si vous
concern.
voulez, c'est ça
And there is
qui
a risk
inquiète
in different
actuellement.
areas
Il y
of
a un
Canada, not
risque dans
everywhere,
différentes régions, pas partout,
that
mais
these
on risque
variants
que ces
could
variants
result in the
entraînent
disease activity taking off fast.
un décollage
So it
accéléré
is,
de
as
la
I've said,
maladie.
a pretty
Comme je l'ai
critical moment.
dit, c'est un moment crucial
And that, we seek
et
everyone
on
to
veut
do
que
the
tout le
very
monde
best that you can
fasse de son mieux
to keep up with the
pour
local public health
maintenir
advice and
donc
protect
les
yourself and your loved ones through these
modalités
protective
de
measures,
santé
which we
publique, donc
said
prendre des
again and
mesures
again.
de protection
Mask
qu'on a
wearing, washing your
répétées,
hands,
les
watch your distance
masques,
as much
le
as
lavage
possible.
de mains,
We
la
know that
distanciation
some people
le
do have to work.
plus possible. On sait que
Some,
certains
kids
d'entre
are
vous
going to
doivent aller
school, but you
travailler, les
need to do
enfants vont
that
à
really
l'école, mais
safely.
il faut que
And
tout
that
se
does have
déroule
to
dans la
depend on the
sécurité.
local epidemiology.
Et
But on the whole, we're
de
just
façon
asking people to
générale,
hold on for a
nous
bit
demandons aux
longer because
gens
the
d'attendre un
vaccines
petit peu parce que
are
les
just
vaccins
escalating. Now is not the time, but there will.
sont en train
This is
d'être
not
déployés.
forever, and
Ça ne
that
va pas
I
durer
think that is really key.
pour
There
toujours,
is
donc
a
c'est
sense
clé
of
de la
course,
preuve de
this has been going
patience.
on for so long
Bien
that
sûr, les choses durent depuis tellement
many
longtemps
people
que bien des
are
gens
having some difficulties keeping
ont du
things
mal
up. So
à
I do
maintenir le
think
cap, mais
that
je
this is
sais,
absolutely not the
je
time to
pense
let
que
go
ce n'est
of
pas
those
le
measures.
temps de baisser les bras et
It's
de
Dr. New. Maybe I'll just add a
arrêter
few additional
toutes ces
points to
mesures.
what Dr.
Pour
Tam said.
répondre
I
à ce qu'a
think
dit
we are all
la
taking
Dr.
it
Tam,
seriously across
nous
the country.
prenons
We're having active
tout cela au
discussions,
sérieux partout
especially
au pays.
advisory
On a des
committee.
discussions
And there are
au sein
indications
du
based on the
comité
data that we're
consultatif. Les
receiving at the
données que nous
national level
recevons à l'échelle
that,
nationale
in
nous
terms of
indiquent que pour ce qui
hospitalizations
est
and
de taux
ICU admissions,
d'hospitalisation
we're
et
also
des
seeing it
admissions,
happening among the younger age
eh
groups. So I
bien,
think there really
c'est
is
surtout chez les plus
a
jeunes que ça
caution
se
and a
passe.
warning that,
Donc, une petite
everyone
mise
is
en
still at
garde. Tout le
risk
monde est
with
encore
respect to either
donc à
coming down
risque
with it or
pour ce qui est de
transmitting
contracter ou de
COVID-19 to others. And
transmettre la
so I think we
COVID-19
really can
à
let
d'autres.
go.
Donc, on ne doit
Just
pas
speaking
baisser les
personally
bras
here
et
in the
baisser la
Ottawa
garde.
area, where
Ici, dans la
Dr.
région
Tam and myself
d'Ottawa, là où la
listen to
Dr.
what
Tam
Dr. Vera Etches,
et moi,
our
donc,
local medical
écoutons
officer of health, is
notre
saying. And because of the
administratrice
situation
de
in
la
Ottawa,
santé,
getting
Dr.
worse,
Etches.
it
Donc,
looks
les
like,
choses semblent
I guess,
empirer dans la
stricter
région.
measures will be
Des
put in
mesures plus
place. And
strictes
so,
risquent d'être
as we
mises en
said,
place.
it depends
Comme
on
on l'a
local
dit, ça
epidemiology, but
dépend
I think public health
de
authorities across the
l'épidémiologie
country are taking it
locale,
seriously.
mais
And
les
yes,
autorités
if there
prennent la
needs to be
chose très au
stricter
sérieux. Et
measures
oui,
put in
s'il
place, I
faut
think
mettre en
they're
place
prepared
des
to do
mesures
that.
plus strictes, on
Thank
est
you.
prêt à le faire. Merci.
Thanks. Follow-up, Mike?
Yeah, and just as a
Question
follow-up, you
complémentaire.
talk about the spread of the B117
Vous avez
variant,
parlé de la propagation
being
du
more prevalent in younger
variant
adults. I guess I want to
B117 qu'on
follow up on
retrouve de
the
plus en
stricter
plus chez les
guidelines.
jeunes
But
adultes.
do you think that there's
Vous avez
a
déjà
sense out
parlé
there
des
that because
directives
the
plus
vaccines
strictes,
are rolling out,
mais étant donné
that
que les
people
vaccins
aren't
sont
really making the
déployés,
connection? They think that the finish
pensez-vous
line is already there,
que les
even
gens
though they don't
pensent
have a
qu'on
needle
voit
in
le
their
bout du
arm yet.
tunnel alors qu'ils n'ont pas encore
And
reçu le
how much are
vaccin?
you concerned that the spread will now be in that younger adult population
Craignez-vous
that
que
is
ce
harder to
variant
control or
se
harder to get the
propage
attention of
chez ces
to
jeunes
to
et que
continue
ce
to
soit plus
do
difficile
those follow the public
de
health
les
guidelines?
rejoindre et de les amener à
Yes,
suivre
I
les
think we
directives de
have
santé
to
publique.
remind everyone that less than 10%
Oui, je
of
pense qu'il faut
Canadians
rappeler
have
à tous
received a
que moins de
vaccine.
10% des
And they're
Canadiens ont reçu le
mostly
vaccin.
people, of course, in the higher risk groups, and
C'est
therefore
surtout des gens dans les catégories
the
d'âge les plus
older
à risque,
population. So it
soit
is
les
a
personnes les
really
plus
tricky
âgées.
situation
C'est donc
because
une
of the
situation
spread
assez
occurring in the younger
délicate.
age groups, while they are the ones waiting
Le
further
virus
down
se
the line to
propage
get
chez les
vaccinated.
plus jeunes alors qu'ils
And
sont
so,
les
which is
derniers
why
dans la queue pour
the
recevoir le
overall
vaccin.
strategy in Canada is to get
C'est
that
pour ça que
first
la
dose
stratégie
to as
globale au
many
Canada,
people as
c'est
fast as
d'administrer le
possible for
vaccin
this very
le
reason
plus vite possible au plus
that
grand
we
nombre
need
de
to not
personnes
just focus on the high risk groups,
pour la simple
but
et
if we
bonne
want to
raison qu'il ne
get
faut pas
this
se centrer
epidemic,
uniquement
break
sur les
the
groupes les
back
plus
of
à
this
risque,
current wave, we have to
mais
try and get as many vaccines as fast as
également
possible into the whole
sur
population.
la population
So it
générale.
is something
C'est
I
la seule
agree
façon
that
de contrecarrer ce
we have
virus.
to do very specific and targeted outreach
Il
and
nous faut par
communication
conséquent
to younger
rejoindre
adults
les
as a
jeunes
result, and
adultes
that also encourage them not too far down the line,
et
by the
les
way,
encourager
that they
dans un
should
avenir
also
pas si
roll up their
lointain
sleeves and get the vaccine
de
as
se
well.
retrousser les manches et recevoir le vaccin eux-mêmes.
Yeah, Dr. New, I think
Ici
the
le
issue
docteur
of
New.
enhancing Canadians' confidence in vaccines,
On
including
essaye
younger age groups,
d'augmenter la
is
confiance
top
des
of mind. I
Canadiens dans
think
le
we're pulling
vaccin,
out all the
y
stops
compris chez les
using
jeunes adultes. C'est
all
une
sorts of
priorité,
different mechanisms, be
une
it
grande priorité à l'heure actuelle.
training webinars for healthcare providers so that they can give
On
good
offre
information to their
des
patients so they can make
formations
an
au
informed
personnel
choice
soignant pour qu'ils puissent
using
bien informer les jeunes
various
et leur
sort of
permettre de
social
prendre une
media
décision
and
éclairée.
other types of
On a
campaigns
recours
to
aux
get the
médias
message
sociaux
across.
également et à
And I
différentes
guess
sortes de
also
campagnes
to,
pour
I guess,
rejoindre cette jeune population.
see what local authorities are doing. We understand it in some
Ensuite,
provinces.
on
They
examine
are
ce qui se
actually
passe à
starting to
l'échelle
target
locale. Dans
younger
certaines
individuals
provinces,
based on their local
on
epidemiology
cible
with the
les
vaccination
jeunes
campaigns.
étant donné
As at the same
les
time, of
données
course, they're
épidémiologiques
focusing on
locales.
the older age groups and the
Parallèlement,
higher
ils sont
risk groups.
centrés
So
sur
I
les
think
personnes
there's
plus
lots
âgées et les
that
groupes plus à
still
risque.
will be done. And
Alors,
as
je
we get
pense
more,
qu'il y a beaucoup de
millions more
choses
doses coming to the
qui
country,
seront
that
faites et à mesure
it will
qu'on
get,
reçoit
as
des
you
millions
say,
de doses,
less and less of an issue as more and more
ça
Canadians take
deviendra
up
de
the
moins en
offer to
moins un
become
problème
vaccinated.
parce
Thank
que
you.
de plus en
Thank you. Merci. Next question.
prochaine question,
Thank you. Our next question is from David Thornton
David
from CBC
Thornton
News.
de
Please
la
go ahead.
CBC.
À vous la parole.
À vous.
Hey, so as more Canadians get their first shot,
À
I'm just
mesure que
wondering,
les
what does that
Canadiens sont
mean for
vaccinés,
family and social gatherings,
qu'est-ce que ça
especially
veut
with,
dire pour les
the
familles
Easter
et les
weekend
rencontres sociales?
approaching,
Il y a
even,
le congé de
Victoria
Pâques
Day in
qui n'est pas
May.
très loin.
You
Il
know,
y a
does
la
this
journée de
change
Victoria en
anything for
mai.
people who have been
Est-ce que
vaccinated?
ça
So,
change quelque chose
just
pour ceux qui ont
wondering
été
if
vaccinés?
y'all could comment on that.
J'aimerais savoir si vous auriez un commentaire à faire là-dessus.
Yes, well, Easter's just
Réponse de la
around the
Dr. Tam.
corner, and as I've said,
Oui, effectivement,
the
Pâques, c'est pas très loin.
epidemic may be resurging
L'épidémie est peut-être
different
en
areas of the country.
recrudescence dans
So
différentes
this
régions
is
du
not the
pays.
time to have big
Alors,
gatherings.
c'est pas le moment de se réunir
The
à
vaccine
plusieurs.
is not 100%
Le
protective,
vaccin ne protège
and
pas à
we
100%.
don't actually know, whether protected people could transmit the
On ne sait
virus.
pas si ceux
That
qui sont
being
protégés
said,
peuvent quand même transmettre le virus aux
together
autres.
with the chief medical
Cela
officers,
étant
we
dit,
are looking at
avec les
how do
médecins en
we
chef
adjust
locaux,
public health guidance
on
as more
se
people
demande
become
s'il
vaccinated.
ne faudrait pas adapter les
And,
directives de santé publique à
you know,
mesure que les gens sont
trying to
vaccinés.
get everyone vaccinated with that first dose as fast as possible,
On essaye d'administrer
increasing our
cette
chances
première
of
dose le plus
another
rapidement
layer of that
possible
protection and
pour qu'on
to
soit mieux
our
protégé
defenses, if you like, on top of everything else that's doing, so it becomes easier
et pour que ce
for
soit
society
plus
to
facile
reopen and
pour la
resume some of those
société
activities.
de
So
rouvrir
I think
nos
all I can say
économies et
is that
reprendre nos
things will get
activités.
better if
Je
people
pense que les choses vont
do roll up their
s'améliorer
sleeves.
si effectivement les gens
The
se font vacciner.
other, but one of the first areas I think medical authorities across the Canada will first look at is
Les
the
autorités
long-term care
médicales partout au
homes
Canada
and whether,
vont
of
se
course,
pencher d'abord sur les
our
centres de soins de longue
seniors
durée.
having been in relative isolation for so
Les
long,
aînés ont
that's
été
really
relativement
key
isolés
to see
pendant
what
assez
can be done
longtemps.
in those settings
C'est
to
essentiel de
allow
voir ce qui
more
pourrait être fait dans ces
social
milieux
interactions
pour permettre
and
plus
how
de
to
contacts
protect
sociaux
the people, visitors coming
On
in,
veut protéger les
and the
visiteurs
healthcare
qui
workers.
entrent dans ces
If
milieux
we need to get
et
the
les
rates
personnels
of
soignants qui y
vaccinations
travaillent.
up in those who look after
Peut-être qu'il
this
faut augmenter le taux
population
de
so that
vaccination parmi
they
ceux
can
qui
begin
s'occupent
to
de ces
have more of
personnes
that
âgées
social activity
pour que justement on
of
puisse
connection.
avoir une plus grande
And
activité
so
sociale ou des
I
contacts
think
sociaux un petit peu
we
plus
will be
rapprochés.
watching, the progress, not just in
On va
vaccine
suivre
uptake, but in
l'évolution des
the
choses,
actual
non seulement
disease
dans le
transmission or epidemiology
taux
in the
de
community,
vaccination,
because
mais également
ultimately
dans les données
it's
épidémiologiques
that
dans
will
cette
drive
catégorie d'âge.
how much interaction we can have.
Parce que c'est ça qui va
I think we will
dépendre,
be going back
qui
to say
va
when the weather is good,
déterminer les
just
contacts
get
sociaux qu'on peut
outside.
avoir. Ce
And
que je vous
so
dirais, c'est
those,
que quand
the sort
il
of
fera plus beau,
higher risk
sortez,
settings
allez à
remain the
l'extérieur.
closed, crowded
Les
areas with poor
endroits les plus
ventilation.
à risque,
There
c'est
will
les
be
endroits qui
more
sont peu ventilés,
activities that can
les
be
endroits à
supported
l'intérieur.
outdoors as well.
On
So we've got
pourra
to
se
really
permettre
give people
plus
some
d'activités
other
à
things,
l'extérieur.
some of these kind of activities to look forward to. And
Je pense qu'il faut que les
like we did last
gens
year, in fact.
puissent
So the vaccine, I think,
s'organiser
will contribute
des activités à
to
l'extérieur. C'est bon pour eux.
decelerating the epidemic, but it's not
On
going to do it
essaye
yet.
de décélérer l'épidémie,
Because we haven't got enough people
mais il n'y a
vaccinated.
pas assez de monde qui sont
But,
vaccinés à l'heure
so
actuelle.
not Easter. Easter
Et
is not
donc,
the time to
Pâques,
have big
c'est pas le
gatherings.
moment de se
But
réunir
with
à
time,
plusieurs.
these smaller social interactions, you may see some of the bubbles, sort of concepts coming back in.
On va peut-être
And this
reprendre
time
le
with
concept des
another layer of
bulles
protection, which is the vaccine.
grâce à cette nouvelle couche de protection à notre disposition, c'est-à-dire le vaccin.
Yes, so this
Question
follow-up is for
complémentaire.
Dr. New because
Une
you work
question
so
pour le Dr.
closely on the vaccine logistics file.
Vous
When are the
travaillez
AstraZeneca
beaucoup sur
doses
la
that we're getting
logistique.
from the U.S.? When are they
On est
supposed
censé
to
recevoir des doses
be used
d'Astrazeneca
by?
des
Just wondering
États-Unis.
if you can let us know that.
Est-ce que vous pourriez nous dire qui va recevoir ces vaccins et quand?
Thank you for the question. Certainly,
Réponse
although
du
I work
Dr.
very
New.
closely with Major General
Merci pour
Danny
votre question. Oui, je
Fortin,
travaille de
I
près
don't
avec
have line of
le
sight
major général
those
Danny
various sort of
Fortin.
complex and very detailed logistical aspects. I
J'ai
would
pas
leave it
tous
to
les
him.
détails sur la
Certainly, I
logistique.
see the media
Je m'en
reports as
remettrai à
well in
lui.
terms of doses that may be coming into the country, but other
Évidemment, je vois
folks,
les
obviously,
articles dans
lots
les
of folks are
journaux.
on the file, our colleagues, obviously, as well
On a
in
beaucoup de gens qui travaillent
procurement
là-dessus.
and so on.
Dans
So
le
I
secteur
really don't have
des
much to offer
approvisionnements
except
et
that
autres.
the more doses we
Alors,
get of any vaccine that's
plus on
approved for
reçoit
use in Canada,
des
the better,
vaccins
because then we can
qui sont
obviously
approuvés au
move
Canada,
within
mieux c'est,
Canada to get those shots into
parce qu'on
arms.
pourra
Thank you.
administrer ces vaccins aux Canadiens. Merci.
Thank you. Merci. Once again, please press star one at this time if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 maintenant pour toute question ou commentaire. We have no further questions registered at this time. Nous n'avons plus de questions pour le moment. Je vous retourne la parole. Alors, pardon, nous avons une question de David.
We do have another question from David Thurden, CBC News. Please go ahead.
Hi.
Une
Yes, I
question
just
de la
wanted to
CBC.
circle back because you're taking more questions. That's great.
Vous êtes en
We heard
mesure de répondre
from
à
NACI earlier
quelques
this
questions de
week
plus.
if they would change anything when it comes to their advice,
Le comité
when it comes
consultatif
to
sur
their guidance on
l'immunisation
how AstraZeneca
s'est
could
fait
be
demander
used. Of
s'ils
course, they changed
changeraient
their
leur
advice. It can be
directive
used
sur
for people
AstraZeneca.
above 65 and older.
Est-ce que le
And
vaccin
one
peut être
thing
administré à
that
ceux qui ont plus
Dr.
de
Caroline
65 ans?
Croissant said is that, one thing she might change is the way that this
L'une des
is
choses qui pourrait
communicated.
changer,
But that's not NACI's
c'est
responsibility. That is
la façon
PHAC.
dont les
So I'm just
informations sont
wondering, would you
communiquées,
agree with
mais il ne
this?
revient
Do
pas
you
au
think
comité
that now
consultatif
that
de
we're
s'en
a
occuper,
year
mais
into
plutôt
the
à l'Agence de
pandemic,
santé
that the
publique?
way PHAC
Nous sommes
communicates information, the Public Health
maintenant
Agency of Canada communicates
à un an du
information,
début de la pandémie.
hasn't always been, up to par, and whether
Qu'est-ce que
that
vous auriez à
needs to
dire
be
sur la
improved.
communication de l'Agence de santé publique? Est-ce que vous pensez qu'elle a toujours été
Well,
à
I
la
think
hauteur?
communication
Et
is
sinon,
extremely
est-ce qu'il y a des choses à
important
améliorer?
in this
Réponse de la Dr.
response.
Tam.
One of
La
the
communication est très
really
importante
key
pour
challenges
lutter
is
contre la pandémie.
that information and
L'un des
science
grands défis,
keeps
c'est que
moving
l'information
at
et
a
la
very
science
fast
continuent
pace.
à évoluer très
So
rapidement.
we can always do better in terms of supporting
On
communications,
peut toujours en faire
particularly
mieux,
on somewhat complicated decisions
notamment
and how
quand on
they
a des
are
décisions
arrived
complexes
at.
à prendre
And
et
so
la
I
façon
think
d'arriver à ces
there will
décisions.
be more support to NACI, for example, in communicating their recommendations,
Nous allons davantage
including
appuyer le comité
not
consultatif
just the
pour
publication of their
communiquer leurs
statement,
recommandations,
but a more plain language
pas
version of
simplement par
that.
nos
I think that
déclarations,
is
mais
being
également en utilisant
envisaged
un langage
and
plus
being
simple.
rolled out.
C'est ce qui est
And
envisagé et
so,
c'est ce qui
and
est fait à l'heure
providing
actuelle.
more technical briefing as a sort of regular
Les
occurrence,
briefings techniques,
so
on
that
va les avoir
anytime
à
those
intervalles réguliers
recommendations are put out, it's not just, well, what are the recommendations,
pour
but helping the
qu'on
public
sache quelles sont les
understand what
recommandations,
led
mais
to
également aider
the
la population à
recommendations in
comprendre
the end.
comment on est arrivé à ces
And the
recommandations.
decisions are sometimes complicated. It's not just
Les
based
décisions
on
sont
the evolving
complexes,
data.
oui.
It's
C'est
also
pas
based
simplement parce que
on
les
the
données sont en
realities
évolution
of
constante,
the different products
mais
in
également
Canada and the supply.
parce
And
que
there's more than one vaccine.
on a
So
plusieurs
those
produits
have to be
différents.
taken
Il y a
into
plus
account by
d'un
public
vaccin
health
et il faut en tenir compte
programming and officials.
dans nos
And so
programmes de santé publique.
communication can always be better, is what
La
I think.
communication peut
And
toujours être améliorée, c'est ce que je
we
pense.
should do that. What
Et
is
c'est
the
ce qu'on
point, as I
devrait
said,
faire.
is this sort of every week or so, there's another
On dirait que
additional
chaque semaine,
recommendation,
il y a une
and then how that
recommandation de
fits in
plus.
with the preceding ones,
On
and
se
what
demande comment ça
what
s'imbrique
led
avec
to
les
the change,
recommandations
I do
précédentes
think
et
needs
ce
to be
qui
better
a
communicated.
amené ce changement. Et je pense qu'il faut mieux communiquer aux
It's
Canadiens
Dr.
les
New.
raisons derrière
Maybe
ces
I would
changements.
make an additional point to what Dr.
Ici,
Tam has
Dr.
said.
New, je voudrais
And that's
compléter
the
la
fact that
réponse.
there are many voices out there. And so I think that obviously,
Il y a
as public
plusieurs
health, we
intervenants en
could always
santé
do better in
publique.
terms of self-improvement. But
Oui, en
I
santé
think
publique, on
the
peut
media
toujours
also
faire
needs
mieux,
to understand in terms of
mais
the different perspective and voices out there. And
les
I
médias
would say
doivent
that there is a
comprendre
difference in terms of what Dr.
qu'ils
Tam,
ont un
myself,
rôle à
and the
jouer
Chief
aussi.
Medical Officers of Health
La
are
Dr.
saying and
Tam
giving
et
advice
les
from quote, a
médecins en chef
population and public health perspective, as
donnent
opposed to
la
maybe other
vie
voices out
de
there,
la
which are
santé
maybe looking
publique,
from
mais il y a d'autres
maybe a
voix
different, narrower perspective, a
qui
sort of
ont
an
peut-être une
individual
perspective
clinical
plus limitée,
perspective, et
une
cetera, and so on.
perspective
So I think it's
clinique
just something we need
individuelle,
to be
par exemple.
mindful as well
Alors,
as
je pense qu'il
we
faut
try to get
garder ça
obviously
à
the best
l'esprit.
information out
On
there
essaie
to
de
inform
communiquer les meilleures
Canadians so they can
informations aux
make
Canadiens,
informed decisions
nous, à
regarding
la
their
santé
health.
publique, pour
Thank
qu'ils
you.
puissent prendre des décisions éclairées sur leur santé.
Follow up?
Une question complémentaire?
Yes. I feel like I've won the lottery asking
Oui,
all these,
j'ai
getting to
l'impression
ask all
d'avoir
these
remporté la
questions. So
loterie.
this
On
is
me
my
permet
final
toutes sortes de
question.
questions.
The
Voici ma
European
dernière question.
Medicines Agency has said that Astrazeneca is safe to use, but it can't rule
L'Association
out
médicale européenne a
a
dit
link to a
qu'AstraZeneca,
small
c'était
number of rare blood
sûr,
clots that were
mais qui ne pouvait pas
reported on the
éliminer le
continent.
risque d'un petit nombre de caillots sanguins.
And patients should be on the lookout for warning signs and that kind of thing. So
Et les patients
I just
devraient
want to
être
know that,
attentifs
is there any messaging, we talk
aux
about communication
informations
just
qui
now,
leur sont
that
communiquées.
you want to give
Le
to
service va
Canadians,
reprendre dès que possible. Il y a de l'interférence sur la
again,
ligne.
even if you have to repeat it.
Yes. So I'm going to start, and we have our Health Canada
Oui.
colleague, Dr.
Je vais
Bessione, who may
commencer
want
avec
to
réponse de la Dr. Tam.
provide any additional information that he has
Le
from,
Dr. Berthiaume et le
because
Dr. New sont
Health
également avec
Canada
nous.
has been the one linking up very closely
Santé
to
Canada
the investigations in Europe and the
suit de
European
près les
Medicine
enquêtes qui
Agency.
sont faites en Europe.
So I do think that from a general communication perspective, it is really important
Je crois
to
que du point de vue de la
advise the public
communication
on what
publique,
to expect.
c'est important de
And
dire aux
first of
Canadiens
all,
à quoi ils doivent
we
s'attendre.
need to make sure
D'abord,
everyone
il
knows that
faut s'assurer que
mild
tout le
and
monde
moderate
sache que
side effects
des
after
effets
a
secondaires
vaccine is to be
légers
expected. So
et
the
modérés
pain at
sont
the
assez
injection site, maybe
prévisibles.
fever,
Au
general
site de
tiredness, and muscle
vaccination,
aches
peut-être une petite
can occur
fièvre, des douleurs
and
musculaires
are often are not
sont
infrequent, in
assez
fact.
fréquents.
But they do resolve in
Et
a
ça
2 to
se
3 days.
résout en
The
l'espace de
second
2-3 jours.
dose of
Ça
vaccine
disparaît.
can sometimes
Et
result in a heightening of
parfois, ça
those
peut
reactions,
aussi
which is a sign
mener
that
à
your
des
body's immune
réactions
system is
accrues.
actually
C'est en fait
doing its job
un signe
and
que
mounting
votre
that
système immunitaire fait
defense.
bien son travail, est en train
What is
de
also
bâtir ses
important
défenses.
for everyone to know
Il
is
faut
that
que tout le monde
rare
sache que
but serious adverse
des
events
effets
can
secondaires
occur with
rares
a
sont aussi
vaccine, which is
possibles
not
à la
necessarily
suite d'une
seen in the
vaccination.
smaller
Mais ce n'est
clinical
pas
trials, even though
nécessairement ce qu'on
tens
a
of
vu dans
thousands
des
of
essais
people
cliniques
were
de petite ampleur, même
included in those clinical trials, if the rate of occurrence is, a few cases in a million, you're not going to see that until large numbers of people get vaccinated. And we will always need to take those reports very seriously, and that there is a system which is international that is monitoring, as you've seen in the past days, these events, and they have to be investigated thoroughly. And after that, we need to then solidify the messaging that will need to be communicated to healthcare providers and those providing advice on immunization. So right now, what I said in my opening remarks is it is associated with this low-level platelets, those things that help your blood clot, which is undergoing further analysis. And so I think this will help. Whatever comes out of the further analysis will help people make an informed choice. So right now, maybe I'll pass the mic over to Dr. Bethion.
Thank you, Dr. Tam. Yes, I would be happy to provide a bit of additional information. So to answer your question, I think the key message is that Health Canada has actively looked into this issue, is in contact with other international regulators, and looking at the data, still considers that the benefits of the Astrazeneca vaccine outweigh the risk, especially considering the risk of complication and blood clots that are associated with the COVID infection itself. There is, when you look at the data around these very rare types of blood clots associated with low platelets, the information that was provided by the European Medicines Association is that there were 25 cases over 20 million people vaccinated with the AstraZeneca vaccine. So as Dr. Tam mentioned, these adverse events are extremely rare. There is a subset of those adverse events, 17 of those 25, that are called cerebral sinus vein thrombosis, that are continuing to be investigated. And as we look into them and in collaboration with other regulators, if there's any additional findings, we'll communicate to Canadian. At this point in time, we're actively monitoring, and I can assure you that everybody around the world is actively monitoring this issue. And if there's any conclusion, either to establish that it's not linked to the vaccine or that it is linked to the vaccine, we'll communicate that clearly to Canadians. So at this point, as pointed out, there is a potential risk of these very rare blood clots, but the causal association has not been established, but we're actively monitoring. But overall, if you consider the benefits of vaccination of the AstraZeneca vaccine, the risk of COVID out there in the community, we consider, Health Canada considers that the benefits of taking the vaccine, any vaccine, including the AstraZeneca vaccine, clearly outweigh any potential risks.
Thank you. Merci. Prochaine question.
Thank you. Notre prochaine question est de Julienne.
The next question is from Julienne Lapointe, Radio-Canada. Please go ahead. Hello. So I may ask you to repeat some of this in French. I'm wondering if you can explain why you're saying that there's no risk and everything is safe, but there is this rare risk of blood clots. So perhaps if you could just explain the distinction there. Would you like me to go ahead, Dr. Nia? Yes, I'll let you start, Mr. Bethion. Question. Yes, well, I do think it's always better if we can have someone on the camera answering. It's always hard on the telephone, so I'm hoping if we can get someone with a camera to answer. Answer from Mr. Bethion. Yes, my camera is on, but I'm not sure if you can see it, but... interviewer, yes, go ahead. Answer. Okay, so the question was, how do we evaluate this risk of rare blood clots and the low platelet levels? Now, late last night, Health Canada issued a statement that clearly explained that there were cases reported in other jurisdictions of certain very rare adverse effects, notably cases of cerebral vein thrombosis associated with low platelet levels. Now, the cases that were reported were published by the UK health authorities, and we're talking about 25 cases of adverse effects out of 20 million doses of AstraZeneca vaccine administered. And if you look at those 25 cases, 17 of them were a more specific subtype of thrombosis, so the cerebral sinus vein thrombosis. So those were 17 cases out of 20 million doses. That might be a little bit higher than what you might expect, because this is a syndrome that can happen spontaneously in the population. So it could be related to the vaccine or not. The analysis seems to suggest that, there was no causal link demonstrated between those events and the vaccine, but we are continuing to look into it. What I can say is that initially there were concerns around the world about possible adverse effects from the AstraZeneca vaccine. And when that was analyzed by the European health authorities, the UK health authorities, and the Canadian health authorities, the conclusion was that there is no increased overall risk of blood clots. It's no higher than with the AstraZeneca vaccine than what you would see otherwise. So there's no causal link there that was established. However, with the cases of cerebral sinus vein thrombosis specifically, those cases are being looked into. Again, these are extremely rare events, 17 cases out of 20 million doses. Now, in Europe, if you exclude the UK data, the rate may be very slightly higher. Following the analysis of these events, Health Canada is in very close contact with both the UK and European health agencies, and they both reiterated that they are continuing to look into the data. There's currently no evidence of a causal link between the events and the vaccine, and the benefits of the AstraZeneca vaccine continue to outweigh the risks, particularly if you consider the risk of getting COVID-19 through community spread, the risk of complications from COVID-19, and COVID-19 itself can cause an increased risk of blood clots. Clearly, the benefits outweigh the risk. Question. Yes, so perhaps I'd just like to hear you talk a little bit about the advice you gave to Canadians concerning the Easter weekend and what we should be doing. Answer from Dr. New. I can answer that question. As Dr. Tam already said, now is not the time to slack off or to relax public health measures too quickly. We have seen the cases level off and even increase slightly in some regions of the country. And I think it's very important that we continue with these good public health measures, these proven public health measures, as vaccines continue to roll out. I know the weather is getting better, and we certainly encourage everyone to get outside and enjoy that. We've seen that the risk of getting the virus is much lower if you're outside. It's crowded indoor spaces with poor ventilation that have the higher risk. So we are hoping to be able to get outside for the good weather, But in terms of getting together with people inside, gathering inside for Easter weekend, I don't think it's a good idea.
Merci. Prochaine question.
Thank you. Next question.
Merci. Our question is from Melissa Couton from the Canadian Press. Please go ahead. À vous la parole.
Hi, doctors. Just wondering for clarification on the issue of possible blood clots. Is it just the Astrazeneca vaccine that's being looked at, or are any of the other vaccines being investigated for possible links?
Thank you for the question. This is Dr. Bertium from Health Canada. So at this point, there's no information suggesting that there's a higher risk of these very rare adverse blood clots with the other vaccines that have been that are being administered in Canada.
Follow-up?
Yes, sorry. So we're kind of nearing that 10% mark of Canadians who've received at least one dose of the COVID vaccine. What does that, reaching that kind of milestone mean in terms of actually limiting spread of the virus?
Yes, so this is Teresa Tam. So this is still quite a small proportion of Canadians or people in Canada have been vaccinated. I think that what it means is that we should, as I said, see some of the effects in the initial groups that were receiving the vaccine, such as seniors and those in long-term care in particular. And so what's been really heartening to see is a drop in incidence in those over 80, as well as a reduction in outbreaks in long-term care, and that those outbreaks, when they occur, are generally smaller in size. So that needs to be monitored very closely, but is actually really encouraging. And some of the studies that were done by provinces and territories, actually British Columbia and Quebec, for example, demonstrated a high effectiveness of that initial first dose. So I think that, I am very hopeful that if everyone in Canada continues to roll up their sleeves as the vaccine becomes available, which is actually going to escalate pretty fast, that we will be able to see a reduction in individual impact, but also that indirect benefit to others as we protect each other as well. But that is not going to be seen at this point. And there's still data in evolution, if you like, about the impact of the vaccines in reducing transmission or reducing infection rather than reducing disease or serious outcomes. But we expect those to become more available soon. Some of the vaccines, including, for example, the Moderna vaccine, has shown in some preliminary information a reduction in transmission or a reduction in asymptomatic infection, for example, when people swabbed the vaccinees' noses compared to the placebo, for example. So I expect some of those studies to come up as time goes on. Which is right now is that vaccine is a very important layer of protection, but it is only but one layer of protection, and that we need to keep up with the other layers of protection until the vaccine layer of protection is much more reinforced.
Thank you. On a le temps pour une dernière question.
We have time for one last question.
For one more question and follow-up. Operator, please.
Thank you. Our next question is from Mike Lecoulter from Global News. Please go ahead. À vous la parole.
Thank you for the opportunity to ask this second question. I just wanted to ask that, given what you're seeing in the spread, especially amongst younger people, is there any consideration from public health officials to maybe push the provinces or suggest that younger people should get the vaccine sooner to stamp out this spread that is seemingly more of a concern to you?
So I think that the serious outcomes are still going to be felt much more in the higher risk groups. So that's been the focus of public health programs to date. But the concept that we need to get everyone that first dose as fast as possible, and with the vaccine supply that we have, that can be done before, maybe by the end of June, pending, supplies all going according to plan, is basically takes into account that concept, is that you can't completely just protect the higher risk groups without increasing vaccine coverage in the groups that are younger, who may transmit the virus to others. So that's the trajectory, and that the provinces are working really hard to administer those doses as fast as possible. But I do think that younger individuals who perceive the individual risk as lower need a lot more targeted communications and different strategies to incentivize them in getting the vaccine. And I do think that many of them go to work, and many would want to, for example, go back to university in the fall. And so in order to reduce those kind of disruptions, everybody needs to roll up their sleeves. And so, that the strategy of shifting the vaccination towards the younger population, although not the primary strategy, is behind that one dose for everyone as fast as possible.
Thank you. It's Dr. New. Maybe I'll just underline or underscore what Dr. Tam said, and I think I alluded to it earlier in one of my answers. If you look at the provinces and territories, obviously they have the best line of sight in terms of examining their local epidemiology, their local context, and determining how best to vaccinate their population. And if you look at Prince Edward Island, I understand Dr. Heather Morrison, the Chief Medical Officer of Health, I recently had a press conference in which he indicated, based on their epidemiology, the fact that younger age groups or individuals in those younger age groups, especially in frontline sort of service industries dealing with the public, were also, I think, the group that had the highest risk of, having COVID-19 and possibly transmitting to others, that they're also targeting them, along with obviously their high-risk seniors, et cetera. So you can see it's starting to be a part of the thinking and sort of the thoughtful approach that the various provinces and territories are undertaking. Thank you.
And one last follow-up, Mike?
Yeah, I just wanted to ask you, for both Dr. New and Dr. Tam, is there any sense of frustration on your part when you look at the rollout and how it hasn't been equally as efficient depending on the provinces? One sort of looks at Quebec and Ontario, where Quebec is seemingly moving the age brackets through the vaccination process a lot quicker than Ontario is.
Well, I think the rollout of the vaccine program is absolutely a provincial and local responsibility. It is complicated, so I think one does have to be a bit patient, and as things get more, moves along more, as the vaccine program moves along more, I would certainly want to see that that acceleration continues, because there's going to be a lot more vaccines coming in the coming weeks, like over 1 million doses in the next several weeks. And that, that's when I think we will see that escalation occur. But it is complicated because, the initial Pfizer and also to a certain extent the Moderna vaccine has significant logistical issues. Some of that because of the sort of freezer requirements. But some of that has been, those requirements have been reduced. And also with vaccines that might be easier to handle and administer, yes, it's easier to use them, but they need to set up a whole other set of channels to deliver them, given that opportunity. So I think what you'll be seeing is that provinces are going to be leveraging pharmacies and other venues that they haven't done before. So I think, we need to give them a bit of a chance to set it all up. But for sure, I'd like to see that escalation in vaccines, and that where, there's not too much vaccines that's been delivered that's hanging around, but I think we will see.
Thank you. So this is the end of our press conference for today. Merci d'avoir été avec nous. Je vous souhaite une bonne journée.
Merci. Merci. Thank you. The conference has now ended.
If you are the meeting host, enter the host key